Good morning. I want to thank you, gentlemen, for joining me here on the Valder Beebe Show, live out of Dallas, Texas. And I hope you're having a great day. So am I. Let's get started. I want to start off with you, Dr. Greenwald. I just need to shake things a little bit differently. I'd like for you to give us a synopsis version of what asthma really is before we speak about it.
Sure. Yeah, and that's a great question. So asthma represents when your airways, your breathing tubes get so inflamed that it's hard to breathe out. It causes symptoms such as coughing, wheezing, maybe waking up suddenly in the middle of the night, shortness of breath, even chest tightness and pain. And then it makes all the exercise and activities that you want to do so much harder. You're not able to jog, you're not able to bike at the same rate. You might have to stop or maybe not even go. Kids are going to have a harder time sort of making it through recess or making it through soccer practice or whatnot. So really that's what asthma represents, is just sort of this sort of inflaming of the airways of all sizes.
Thank you so much for that explanation. I want my audience to know that Dr. Matthew Greenwald is a medical doctor. He's board certified in pediatrics and allergy immunology. I'm going to go to you, Mr. Mendez. You have a report that reveals what Dr. Dr. Greenwald was speaking about. So could you tell us about the report that reveals about asthma trends in the United States?
Sure. Our report looks at the 100 largest cities and the ones that are most challenging to live in with asthma. And per what Dr. Greenhot said, from an individual patient point of view, we use three things: asthma prevalence, emergency room visits, and asthma mortality. Now, Dallas ranks number 36 out of 100 in the report, and it actually has the second highest number of uninsured patients, and that creates great risk when you're uninsured and you don't have access to care. So it's really important to make sure that you're on your medications, that hopefully you could see a specialist, but actually have access to care.
And I apologize to Dr. Greenhot. I mispronounced his name. Please forgive me. I want my audience to know that Kenneth Mendez, he's the CEO and president of the Asthma and Allergy Foundation of America. He comes well qualified to talk on this topic. Dr. Greenhalt, tell me, September being the peak of the allergy asthma season, what goes on in September?
So September is just a time of year when a number of different triggers sort of all are prominent and present at the same time, making it really, really hard for patients with asthma. It's so much easier to get sort of a flare at this time of year. Not that other times of the year are not a challenge. Certainly as an allergist, your mountain cedar season in Texas is nothing to be messed with. But this time of year, you have ragweed, you have mold. These levels tend to peak right around now. Then you have kids returning to school. They're passing viruses and infections, not only to one another, but they can bring those home to other family members. So sort of everybody gets affected. The air quality at school can be variable. I mean, it can be dusty. There can be lots of industrial cleaners that might sort of cause some irritation and flare somebody's asthma. And then you bring in the natural disasters. So in certain parts of the country, you've got smoke from wildfires, as well as, Texas has some of the Gulf area. Hurricanes can be another thing this time of year. So all of this is just unique to September. And really that's what sort of pushes up the emergency room visits and the hospitalizations.
Okay, these are all factors that a person can't control. How do they protect themselves when this is happening?
Sure. So if, say, as a doctor, we happen to prescribe you medication, please fill it. Then also please use it. I cannot emphasize more that, everybody says that they'll do it, but not everybody actually has it. So take your medications. And then if we give you medications for rescue or something like that, if you're having a flare on the go, please have that with you, because when it's at home, it's not doing anybody any good. So this is the time of year. Talk to whomever is taking care of your asthma. If it's a generalist and you're feeling that your asthma control isn't good, ask about seeing a specialist. I know most of the allergists, immunologists in the Dallas-Fort Worth area, some really excellent doctors who you can go to, and they can really help sort of personalize an action plan for you. This action plan sort of walks you through, what do you do on an average day? What do you do when you start to feel like your symptoms are tipping over in the direction of an attack? And then what do you do when you're having an attack? This can be downloaded from our website website, www.aafa.org, in English and in Spanish. And this really allows, us or whomever as the specialist to take a detailed look at what factors drive your asthma to make sure that you're getting individualized care.
One more question for you, Dr. Greenhalgh. You said see a specialist. What's the title of a asthma specialist?
Sure. So you have allergist immunologists. So we take care of disorders of the immune system as well as allergic diseases. Asthma is an allergic disease. One can trigger the other in terms of allergies triggering asthma. And then pulmonologists are another source of asthma care, and they specialize in the lungs. In some places, we sort of do a little bit of both or whatnot, but that gives you two types of specialists that can go and take care of your asthma.
Thank you so very much for that clarity. Mr. Mendez, there seems to be some serious disparities in asthma care. I mean, there's disparities in everything. I got a whole list of that. But can you tell us how race, ethnicity, income, and access to health care play a role in these outcomes of having a disparity when you can't breathe?
Sure. Well, in our report, the communities that rank highest tend to have high populations of Black and Hispanic community members. And what a lot of people don't realize is that between 9 and 11 people die each day from asthma. Black Americans are 3 times more likely to die from asthma, 5 times more likely to be treated in an emergency room, and Black women have the highest mortality rate of any gender or ethnic group. And then when you look at children, 50% of them are on Medicaid or CHIP, the Children's Health Insurance Program. So access to care, and when I mentioned earlier, Dallas has the second highest number of uninsured patients. Having access to care so you can fulfill the medications, get the medications that Dr. Greenhalgh is talking about, is really important for those communities. And when those communities can't fulfill those medications because they don't have access to health care, then that can be very challenging, if not life-threatening, if you have asthma.
Okay. What's a person to do when we keep hearing that rural and urban hospitals are overcrowded and closing, and you say that seek access to care, but what is this group supposed to do?
Yeah, well, there are a couple things you could do. You could visit our website, aafa.org. We have a lot of good resources there on, in fact, we have a section called Ask the Allergist. So Dr. Greenhalgh talked about allergists and immunologist specialists. You could actually upload a question or ask a question, and we can get that answered for you. And we've got links to other places where you can find access to care, access to doctors in your community. And that would be one thing in one place to start for if you have asthma and allergies.
Before I let you guys go, I'm going to take this one from, where's it coming from? Facebook. My audience is spread out over multiple platforms. And the poster wants to know, as professionals talking about the topic of allergies and asthma, how are you combating the cut in supporting them? Excuse me, it's kind of a little bit hard to understand. How are you supporting them when their funds are being cut, their services are being cut, their benefits are being cut, but yet we still need care for allergy and asthma? Can you answer that?
Yes, absolutely. One of the other things that we do as a national organization is do advocacy work, whether that's on a state or a federal level. So we've been advocating, for example, for a program called the National Asthma Control Program, which initially had all the staff fired as a result of the reductions in force at the CDC. This program is embedded at the CDC, and it's a program that funds state-based asthma programs, the kind of care that you're just talking about. Thanks to our advocacy work, they reinstated the staff at the CDC's National Asthma Control Program because they realized for every dollar that you spend, it returns $71 in cost savings in the community. So we're trying to raise the awareness level of the costs and the access issue with federal lawmakers and with state officials so they make sure that they could continue the care that people need when you have asthma or allergies.
Kenneth Mendez and Dr. Matthew Greenhawt, thank you so very much. This has been very worth your time, and I really appreciate it. You'll probably never know the difference that you've made, but thank you for being my guest on the Valder Beebe Show. I truly appreciate it.
Thank you for having us.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebeShow. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebeShow and stay connected as I interview the world's most fascinating people.